A 60-year-old man is diagnosed with colon cancer with several lesions also found in the liver. Which of the following was most likely involved in causing this patient's liver lesions? Choice A, TNF-alpha. Choice B, elastase. Choice C, Streptococcus galolyticus infection. Choice D, caspases. Or choice E, cell metaplasia. I'll wait 5 seconds and answer the question. Questions that look like this one have shown up several times on the MBMEs, and sometimes people think you have to go out of your way to memorize some obscure thing with these questions, but really what they're testing you on is, do you understand what causes metastasis? What kind of change needs to occur for that to happen? And the basic answer is, for metastasis to occur, tumor cells need to invade through the extracellular matrix and the basement membranes. So what they're always looking for is one of the answer choices will have to do with how these cells are breaking those things down. So here choice B, elastase, is the best answer, because elastase can be used to break down extracellular proteins or laminins, which can exist in the extracellular matrix or basement membranes, and will allow the tumor cells to basically escape being an in situ tumor, essentially. So there's all kinds of correct answer choices they can write in these kinds of questions. Collagenase for type 4 collagen is a common one. Cadherins can occur occasionally because cadherins hold cells together. So in order for metastasis to occur, sometimes you need the cells to kind of unhook from each other through the destruction of cadherins. So it's more about you understanding that big picture concept that metastatic tumors are about the tumor cells needing to destroy the ECM and the basement membrane before they can exit being an early stage tumor. Another sort of related question to this is when they test you on what's the worst of the following cancers, and they give you a bunch of answer choices of varying grades and stages of cancers. So what they really like doing is that they give you high grade cancers with low staging, which is to say that they have really bad metaplasia, dysplasia, but then they say, oh, it's all contained within the basement membrane. And then it's like, okay, that's not as severe as a cancer that doesn't have as bad dysplasia, but it's broken through the basement membrane. USMLE really likes for you to understand that staging on tumors is more important than grading a lot of time, and what causes the staging to go up, which is lymph node spread or metastasis. So let's take a look at some of these other answer choices. Choice A, TNF-alpha. TNF-alpha is cachexia factor. So as far as cancer goes, it's why you see cachexia. They get really thin, they lose a lot of weight. TNF-alpha is otherwise really high yield for immunology. It's highly involved in shock alongside IL-1. Usually when they talk about shock, you'll have release of IL-1, which causes a lot of the fever, and then TNF-alpha causes a lot of the other bad things like hypotension and intracellular permeability, that sort of thing. Choice C, Streptococcus galolyticus infection, formerly known as Streptococcus bovis. This is associated with colon cancer, and sometimes in colon cancer you can get Streptococcus galolyticus bacteremia, but it's only really correlated with colon cancer, and it's kind of low yield in general. And also that just has nothing to do with metastasis. Choice D, caspases. So I've talked about caspases in the past. You should know that caspases are involved in apoptosis, and downregulation of pathways related to caspases can be part of what causes malignant transformation in the first place, because obviously if you have less apoptosis going on, that can lead to the perpetuation of tumor cells or cancerous cells. But of course, it has nothing to do with metastasis either way. Choice E, cell metaplasia. Similar to caspases, this is involved in tumorigenesis, but it really has nothing to do with malignant change. So bringing it back, questions like this, it's all about you understanding the big picture concept of what causes metastasis in the first place. And it's breakdown of extracellular matrix, breakdown of basement membranes. And you just need to understand what those things are made up of. You need to remember stuff like collagen 4. You need to remember stuff like laminins and how cadherins hold cells together. That's what they're really testing you on. I hope you found this video helpful. I'll see you in the next one.